Welcome everyone to the Evidence Hour. Today we're going to hear about research regarding housing stress and child maltreatment. I am so pleased to introduce today's presenters. Caroline Chandler is the principal author of the systematic review we're focusing on today. She's a doctoral candidate in the Department of Maternal and Child Health at the University of North Carolina Gillings School of Public Health. She is joined by Tien Ng from Futures Without Violence. Tien has an extensive background in helping folks to translate and apply relevant research, build knowledge, and generate culturally authentic evidence to improve outcomes for families impacted by adversity and trauma. Together, they will help us make the most of this research. Caroline, I will now turn things over to you.
Great. Are you all able to hear me now?
Yes, ma'am.
Wonderful. Thank you so much for that introduction, Susan. And it's so great to see so many folks here from so many places around the country. And I am excited to share with you today the findings from the systematic review on the association of housing stress with child maltreatment. And I just want to start by thanking my co-authors who I conducted the systematic review in collaboration with, Dr. Anna Austin and Dr. Megan Shanahan, both of whom are assistant professors in the Department of Maternal and Child Health at the UNC Gillings School of Global Public Health. So just a quick overview for today. I'm going to start out by discussing why we are interested in examining this question on the association between housing stress and child maltreatment, and some of our theoretical understandings of the relationship between housing stress and child maltreatment. I'll then spend a few minutes talking about systematic reviews and how systematic reviews help us to synthesize the best available research on a topic and why we use systematic reviews. And then I'll briefly describe the methods that we use to conduct this systematic review and provide an overview of the results from the research that we identified, and then finally discuss the implications of this research for future research and for policy and practice. And then I'll turn it over to Dr. Tien Ng to discuss a protective factors framework, and then we'll come back together with some time to answer questions. So we approached this systematic review with an understanding that poverty is a well-known risk factor for child maltreatment, and that material hardship is a term used to describe one's ability to meet basic needs that has been recently used as a direct measure of the ways that poverty impacts daily life. And that finally, housing stress is one form of material hardship that is commonly experienced by families. And so I'll break down each of these assumptions a bit more. So we know that poverty is a risk factor for child maltreatment. There are a number of studies that have demonstrated this. The data from the 4th National Incidence Study of Child Abuse and Neglect shows that children of low socioeconomic status are 3 times as likely to have experienced abuse and 7 times as likely to have experienced neglect as compared to those peers who are not living within low socioeconomic status. In randomized studies of families receiving TANF, or temporary assistance for needy families, cash benefits, and child support, children in families that were randomized to receive more child support had a lower likelihood of CPS investigated maltreatment compared to families who were randomized to receive less child support. So demonstrating that additional child support really helps families out. We also know that in a study of children who were followed from birth in California, lower levels of maternal education and Medicaid as the primary payer of for delivery of healthcare, those 2 factors were associated with an increased likelihood of CPS involvement between birth and age 5. And then we also know that analyses from some administrative data from a Midwestern metropolitan area showed that the length of time that families spent in poverty-related programs such as Medicaid, TANF, that length of time was associated with an increased number of CPS reports between birth and age 15 years. And so all of these studies really demonstrate that poverty and the inability to meet some basic needs is really an increased risk factor for child maltreatment. Recently, material hardship has been used as a direct measure of the ways that poverty impacts the day-to-day lives of families. So these measures of material hardship are difficulties meeting basic needs, such as housing stress, food insecurity, utility shutoffs, and medical care is a representation of the manifestations of poverty. And measures of these factors capture the direct impacts of poverty on the daily lives of families. And there's been research showing that these measures of material hardship are associated with an increased likelihood of various forms of maltreatment, both abuse and neglect. So for example, in a study of families receiving TANF benefits, there are a greater number of material hardships within these categories, so a greater number of these different forms of material hardship was associated with an increased likelihood of CPS investigation, which suggests that we need to examine these material hardships further to understand kind of what is going on here, what are the mechanisms that are leading to this increased CPS investigation rate. And third, we know that housing stress is a common form of material hardship, especially among families with young children. There's no standard definition of housing stress in research or practice. And so we generally define housing stress fairly broadly. And we define it broadly to include measures of housing instability, housing insecurity, insufficiency. This is encompassing of homelessness, eviction, overcrowding, or doubling up, poor physical housing conditions, frequent moves, as well as high cost of housing relative to families' income. And according to the US Department of Housing and Urban Development, or HUD, 21% of individuals who are experiencing homelessness in 2017 were children who were under the age of 18. So that's a fifth of the total population who is experiencing homelessness were children. We also know that families with children made up a third of the total homeless population. And in addition to that, we also know that families who have children are more likely to experience eviction than households without children. And 1 in 4 children and families who are living below the federal poverty level experience eviction before the age of 15. So this is a really widespread issue that really deeply impacts a lot of families in the United States. And so how then does this really vast issue of housing stress relate to child maltreatment? And so one framework that we can use to hypothesize or try to understand how material hardships, including housing stress, are related to child maltreatment is through this framework called the family stress model. So the family stress model is a framework that hypothesizes that economic pressures, including material hardships, as you see here on the right, create stress or can create mental health conditions that contribute to an increased risk of adverse child outcomes, including harsh or neglectful parenting. And so this just provides kind of a theoretical frameworks for how we can understand how these different factors within a family are all related. And so with all of this background information and this theory in mind, we wanted to understand what does the research currently tell us about the association between housing stress and child maltreatment. So given all of this evidence, we know that poverty is a risk factor for child maltreatment. Housing stress is one manifestation of poverty. We sought to synthesize and evaluate the existing literature on the association between various forms of housing stress and child maltreatment to further our understanding of the potential for housing policies and programs and reforms to act as child maltreatment prevention strategies, to really act as primary prevention strategies. And so why use a systematic review? before I dive into what a systematic review is, how many of you are familiar with a systematic review? Go ahead and raise your hand.
All right, Caroline, we've only had about a dozen folks raise their hands, so I think people are not familiar with systematic reviews.
Okay, great. Well, I'm glad that we planned to go over systematic reviews. And based on that response, I'm guessing that not many of you have conducted a systematic review, but can you raise your hand if you've conducted a systematic review before?
Looks like we have about 7 folks.
Okay, wonderful. Well, I'm glad that we have some folks here who are familiar with the process of conducting a systematic review, and glad that we've planned to go through this process, and hopefully you will be able to learn a bit more about how beneficial the approach of systematic reviews are in synthesizing research. And feel free to chat in questions. Glad to answer some questions, or can answer them at the end as well. So in research, we use this pyramid of study design types to really generally describe the rigor or quality of different study designs. And so in general, as you move up the pyramid, the quality or rigor of evidence typically increases. So each of these study designs has unique strengths and limitations that contribute to the reliability or our ability to extend findings, or suggest that the result of a study may be true in communities beyond the one that was studied in a single research project. And so when we examine evidence from a single study, we have to consider each of those strengths and limitations and understand that the findings from that single study may or may not apply to a different group of people or a different context. And so systematic reviews and meta-analyses are at the top of this pyramid because they're used to synthesize the existing body of research to build a more comprehensive understanding of a topic. So they take all of the studies on a topic that may fall into any of these categories of study designs and pull them all together and synthesize what we know. So systematic reviews really consider all of the available evidence on a given topic. And in summarizing that evidence, give us a really comprehensive overview of what we know on a given topic. And in summarizing that existing evidence, we can also identify consistencies or inconsistencies across study findings. So we may find that an association exists in one study but doesn't exist in another study. And we can also use this to identify different gaps or limitations in research or in the evidence base. And when I say evidence base, I broadly mean all of the different research on a given topic. And so when we identify those gaps or limitations, that can provide us direction for where we can conduct new studies. It also allows us to draw conclusions based on multiple studies with greater confidence because we have a more complete picture of the relationship of interest. And so this is generally why we would use a systematic review. And when conducting a systematic review, we generally follow this process. We first define the research question and define different criteria for describing the types of evidence that we're looking for. So in this case, we were interested in the association between housing stress and child maltreatment. And on the next slide, I'll go through some of the criteria that we use to whittle down search results to identify articles that met our interests. So some of these inclusion or exclusion criteria would typically include factors like the types of studies that we'll consider, or the geographic location, or the population of the study. And once those criteria are defined, we then conduct a systematic search in catalogs or databases of literature using key search terms that are related to the topic. And so once we've systematically pulled through these different databases, we pull the search results from the searches to identify articles that meet those predefined inclusion or exclusion criteria. Then in step 4, once we have identified those articles, we pull out information on the study population, the study design, key findings, strengths and limitations of the study, any of the data that we're interested in considering. And then once we have all of that data laid out, we finally can synthesize common and divergent themes across studies and draw conclusions based on this full body of research. And so this is the process that we followed in conducting this systematic review. So as I said, one of the first steps is identifying inclusion and exclusion criteria. So in this review on the association between housing stress and child maltreatment, we included articles that reported quantitative measurements or the numerical risk of child maltreatment based on various forms of housing stress. We did not include articles that reported only qualitative findings, such as findings from focus groups or interviews that didn't have any measure of numerical risk or numerical risk estimate. We also did not include studies that reported on changes in risk after families had participated in a housing program or intervention, because we were interested in understanding the baseline risk for maltreatment that was associated with housing stress, rather than how that risk might change with a really well-designed and really well-implemented program. We also excluded studies that measured housing stress only at the neighborhood level, such as eviction rates within a neighborhood or a zip code, because we were really interested in understanding experiences at the family level. And then all of the studies that were included in this review were published in English. They were published in peer-reviewed journals, and all of them described populations living in the United States. So we searched 7 databases, as you can see in this top box here. This is called a prism diagram, kind of documenting how many articles were identified and how many articles were included or excluded in each step of that process that I described. And so after following this systematic process, we identified 21 articles examining the association between housing stress and child maltreatment. Within these 21 articles on the association of housing stress and child maltreatment, researchers examined 9 distinct measures, or distinct forms of housing stress. And in the next slide, I will go over some of these findings. And just want to say that while the findings that I present are mixed, there were some that did demonstrate associations between housing stress and child maltreatment and some that did not. There was evidence of associations between most of these 9 forms of housing stress and child maltreatment. So as I walk through this table, I want to just point out we have the 9 different measures of housing stress that we identified in the body of research that we examined here in the left-hand column, and then the different forms of maltreatment that were measured in the right-hand column. And a green check mark indicates that a housing stress measure was associated with an increased likelihood of child maltreatment outcomes in the right-hand column, while the red X indicates that researchers found no association between this form of housing stress in the left-hand column and the maltreatment indicators in the right-hand column. And so, as you can see, in addition to these 9 different measures of housing stress, child maltreatment was also defined in many ways, including investigated and substantiated reports from Child Protective Service System records, out-of-home placement following a substantiated report of maltreatment, as well as maltreatment behaviors that were self-reported by a parent or caregiver. And so where you see self-reported maltreatment, we are referring to actions by a parent or caregiver on a child. So I'm going to walk us through this table and break down a bit more what we found in each of these studies. So in this top row, there were 4 studies that examined risk associated with homelessness or eviction. And among these 4 studies, there was evidence of increased risk of families having an investigated CPS report an increased risk of child out-of-home placement, and an increased risk of maternal self-reported physical abuse. Here, it's important as we're going through this to really emphasize that homelessness itself is not included in most statutory definitions of child neglect, but may be a contributing factor to other conditions that would be considered child neglect. In this second row, we identified 6 studies that examined risk associated with staying in a homeless or emergency shelter. Of these 6 studies, 2 of these studies identified an association between shelter stays and an increased risk of out-of-home placement. However, 4 other studies did not find associations between shelter stays and substantiated reports to CPS, child out-of-home placement, or caregiver self-reported CPS involvement. And so this row really highlights one of the reasons that we don't rely on single studies to draw strong conclusions about risk factors. As you can see, some of these studies found that child out-of-home placement was associated with homeless or emergency shelter stays, and some were not. Some did not find an association between homeless or emergency shelter stays and child out-of-home placement. So moving on to these next few rows, both foreclosure filing and housing instability were associated with an increased likelihood of investigated CPS reports, but physical housing risks were not associated with CPS investigation. There were 2 studies that relied on CPS case report data that found evidence of housing inadequacy as it was documented in those CPS case records being associated with child maltreatment related deaths. And here, housing inadequacy was very broadly defined and extracted from CPS case records. And so we don't know if there's a possibility here that those cases that resulted in a maltreatment related death might have been examined more closely than other cases, and what kind of was included in that definition of housing inadequacy. But moving on, we looked at 2 studies that examined experiences of families living doubled up, which the Department of Housing and Urban Development defines as 2 or more families living under a single roof or in a single household. And neither of these studies found an association between living doubled up and substantiated reports of maltreatment, or between living doubled up and maternal self-reported abuse of the child. We examined 3 studies that looked at housing unaffordability. And of these 3, 1 study asked adults to retrospectively report experiences of housing unaffordability and maltreatment in childhood. And based on those retrospective reports from adults about their childhood, they found evidence of an association between housing unaffordability and child maltreatment. However, 2 other studies did not find evidence of an association between housing unaffordability and child out-of-home placement or maternal self-reported maltreatment of the child. And then finally, in this last row, we identified 4 studies that used composite housing stress measures that included measures of several different forms of housing stress. And all 4 of these studies found evidence of associations between housing stress and investigated and substantiated CPS reports and maternal self-reported maltreatment of a child. And so, although these measures of housing stress and child maltreatment really varied widely across studies, we did identify a few key themes that we want to point out. The most common forms of housing stress that were measured in these studies were homelessness or eviction, or homelessness operationalized as a homeless or emergency shelter stay. And among studies that use these measures of housing stress, associations with child maltreatment were variable. And these inconsistent findings may be explained by differences in study design, study samples, operational definitions of homelessness or CPS involvement, but really do elucidate a need for additional research on this topic to really understand what are the mechanisms here that could be driving some of these associations or lack thereof. And the second thing that we want to point out is that some types of housing stress really consistently demonstrated associations with child maltreatment, meaning that we found evidence of associations in all of the studies that examined these specific types of housing stress. And these include housing instability, housing inadequacy, and composite housing stress indices. And we'll talk a little bit more about this composite housing stress index and how that can be used in research moving forward. So in taking in all of these results and thinking about this body of research, there are a few key data considerations that we need to think about when we think about how housing stress and child maltreatment are both assessed in these studies, and how these measures of housing stress and child maltreatment may influence the reported findings and the way we draw conclusions from these studies. So first, focusing on housing stress, most of the measures of housing stress really lack specificity. So for example, we don't know how long families experienced homelessness or stayed in a shelter, or really what the specific conditions were that they were experiencing. And some measures, such as housing inadequacy, as I was mentioning previously, are vague and could include many of these other forms of housing stress. But we think that having a more specific measure of housing stress and the way that families are experiencing housing stress could help us to better understand relationships with maltreatment risk and really eliminate opportunities for intervention. The second thing that we want to consider about these measures of housing stress is that each of these studies use different study populations and different contexts. And we can't really necessarily determine which types of housing stress are most salient to maltreatment risk. So we can't necessarily say that homelessness is presents a greater risk than housing inadequacy. We can't really compare apples to oranges here. And then we also sometimes in these studies don't know if the housing stress or the maltreatment came first. So in other words, we don't know if a family experienced housing stress and then they experienced maltreatment or were subsequently reported to Child Protective Services, or if maltreatment really precipitated families' experiences of housing stress. A report to CPS might have triggered other stressors in the family that led to housing stress. So these are some of the things that we need to think about related to these measures of housing stress. And then related to child maltreatment, we know that child maltreatment is something that's sometimes difficult to detect or identify. Many of the studies that we looked at used CPS data to measure maltreatment, and we know that CPS data underestimates or is not fully representative of children's experiences of maltreatment, because some children who experience maltreatment are never actually reported to CPS. And while this is a frequent concern in pretty much all areas of maltreatment research that use CPS data, a bigger concern here is that in these studies that use CPS data, we're concerned that CPS data may actually underestimate maltreatment to a greater extent among families without housing stress. So what we think is possible is that families who are experiencing housing stress are engaging in social services to meet either their housing needs or other material needs. And they might actually be more closely surveilled or more easily identified and more likely to be reported to CPS. And so if this is the case, this could really skew some of the results that we reported from these studies to make risks associated with housing stress appear more extreme. Conversely, one of the other ways that we commonly measure maltreatment is through self-report. And as I mentioned, a number of these studies did rely on caregiver self-reports of maltreatment-related behaviors towards their child, which again may be underreported, and this would be due to social desirability biases and not wanting to actually report engaging in certain behaviors when filling out a survey or completing an interview. And so each of these factors are important considerations to keep in mind when interpreting these studies. And so there are future directions related to research, policy, and practice that we want to go over. There, as I said, are definitely future opportunities for additional research on this topic to better understand the association between housing stress and child maltreatment. In conducting future research, we should seek to really enhance the specificity of our housing measures to include the timing or severity of housing stress and be really specific in what we mean when we're measuring different forms of housing stress. And as I was just describing, studies should also examine how differential reporting to CPS for families both with and without housing stress may impact results. And as we're going through all of this research, it's really important to remember that association or correlation does not equal causation. So when we say that these different forms of housing stress are associated with maltreatment, that doesn't mean that the housing stress is the cause of maltreatment. And moving forward, we really need to consider and understand any causal mechanisms between housing stress and child maltreatment, and that can be done through really rigorous study design. So this research also has implications for the policy realm. One kind of policy level factor that relates to this work is we hope that the Department of Housing and Urban Development can continue the process that they're currently engaged in developing a comprehensive housing stress measure. So a comprehensive housing stress tool that could measure all of the various forms of housing stress that families experience would allow us to better understand the complexities of housing stress and provide stronger policy recommendations at the national level. But the existing evidence should be considered when we're thinking about the implications of various tax credits, including low-income housing tax credits, child care tax credits for families. We've been hearing a lot about this with the recent policies that are being implemented in response to COVID-19. And we also need to think about whether we consider housing a basic human right and how policies shape access to housing and other basic needs. So this review can potentially inform policymakers as we're thinking about the potential impacts of things like eviction moratorium policies and the risks associated with lifting those policies, especially in the coming months as families are really struggling to meet basic needs due to the really extreme economic impacts of COVID-19. So we're hearing a lot about the impending threats of eviction moratorium policies being lifted. And this isn't necessarily an issue that landlords need to solve at the individual level, but an issue that we can think about and try to solve collectively at the policy level and think about how we can create more affordable housing options in the United States. And finally, this systematic review has some important considerations for practitioners as well. We believe that based on the evidence that was presented that we identified, there are opportunities to promote partnerships between child protective service systems and housing or homeless service systems, and opportunities to collaborate to address some of the common risk factors underlying housing stress and child maltreatment. We also believe that there are opportunities for multi-system partnerships to help address housing needs as families engage with other social services to address material needs such as health coverage and food insecurity. And certainly believe that each time a family interacts with a social service provider, there may be opportunities to address family stress factors that increase the risk of child maltreatment. And so it's important to think about how we can build systems that can really comprehensively meet families' needs at each of these different touch points within the service system. And so we believe that these partnerships and systems that can more comprehensively and collaboratively meet various forms of material needs, including housing stress, could be opportunities for primary prevention of child maltreatment. And so with that, I am going to turn it over to Tian Ung to talk about the impacts of some of this work from a practice lens, and to also introduce a protective factors framework.
Jen, I believe you're muted. No, I'm not hearing you yet.
How about now?
No, not there. I believe for a moment you were unmuted on both devices. No.
Can you hear me now?
Yes. No, we can't hear you now.
How about now?
Yes.
Yes. Yeah, you can hear me now?
Yes, we can.
Okay. Oh my goodness, I'm so sorry, everybody.
And folks at home, I promise you, we practiced right before we started and there were no problems.
There were no problems. All of a sudden I felt like I was in one of these cell phone commercials. Can you hear me now? Can you hear me now? Thank you so much for your patience, everybody. I'm so sorry about that. And indeed, as Susan said, we had a nice little practice session and everything worked out so well. So apologies for that. Thanks so much, Caroline. I appreciate that introduction. I'm going to pick up a little bit from where Caroline left off in terms of talking about the applications for some of this thinking and this discovering some of these findings that Caroline and her colleagues had laid out for both sort of practice design as well as policy implications. But I want to start a little bit and pick up from the frame of a family stress model as well, and share with you what we know from the science of resilience and adversity in relation to stress, about all the things that sort of promote healthy development and lifelong sort of health, learning, and behaviors, and the things that sort of derail it in an effort to sort of apply some of the good information that Caroline has shared for all of the folks on the call today who are here as practitioners, perhaps policy makers, as well as administrators in social services. But just before I get started, a little bit of context about the lens that I bring to sort of science integration. As Susan said, I work at Futures Without Violence, and in that role, I sort of bring to bear, in terms of science translation, sort of several lenses that I want to sort of make transparent before we dive in. So you know the lens by which I filter meaning making. The first is actually as a survivor of child maltreatment and family violence, as a Viet person who is a refugee and traveled here with my family from Vietnam as Saigon was falling. And so those experiences as a child in a family where violence happened, and as a child in neighborhoods where violence was common, is certainly a lens by which I filter my meaning making and translation. I also filter through the lens of a clinician. So I'm a clinical social worker by training and spent much of my career as a trauma therapist. Before I did a stint, I always call it a stint. I think of myself as a recovering academic and an aspiring human. So I spent sort of about 12 years in academia, sort of looking at and studying the science of resilience to get at what Caroline is talking about, you know, trying to understand beyond correlations, what are the mechanisms that that contribute to the relationships that we're talking about today, and certainly material hardship and family violence or child maltreatment in the home. So with that in mind, I want to sort of zero us in this sort of body of work about stress, which is what Caroline introduced us to as the primary model around which she and her team looked at the literature and conducted this systematic review. And I want to maybe zero in a little bit on the model that she drew, which talked about the importance of social support as a mediator or as a buffer to the experience of material hardship, which through the family stress model, right, suggests that those types of external stressors can impact a person or a caregiver's mental health or their emotional well-being, their physical well-being and health as well, which then, of course, impacts the quality of care and parenting that they are able to give, and then, you know, presumably could lead to adverse childhood outcomes like childhood exposure to family violence or child maltreatment in and of itself. And so we're going to dive into that a little bit today and learn from the science of adversity and resilience that not all stress is bad, right? That in fact, we all need a little bit of stress and in our lives, because that sort of helps us to discover some of our own capacities, and it helps us to sort of, you know, generate the type of adrenaline we need to sort of do better than where we were. So there is such a thing as positive stress, as well as tolerable stress, which is, you know, exposure to adversity that that is temporary or mitigated by supports and resources and supports. And these are some of the things that I'd like to ask you all in the audience to think about quite a bit as we go through the rest of our talk today. And then finally, there's some of the stress that Caroline and her colleagues were alluding to, which is the experience of toxic stress, and that's the prolonged exposure to chronic, pervasive adversity that happens in the absence of any type of buffers of mediation, like social supports and relationships, and sometimes faith. These are some of the things that we're gonna talk about today. And these are some of the mechanisms that could be important mechanisms to think about, and certainly the absence of these mechanisms that could potentially explain, as Caroline was saying, that relationship that they found when they did the systematic review between the different types of material hardships associated with housing stress, and whether or not, you know, you're going to see associations with some type of proxy to child maltreatment, whether that proxy is, you know, an actual self-report by a caregiver, or that proxy is, you know, a measure of surveillance in terms of, you know, certain forms of exposure to stress and burden can sort of increase, you know, the community surveillance of children and families, leading to, you know, higher reports of suspected abuse and neglect, which then could lead to, you know, higher substantiation of abuse and neglect. But whether or not that's a direct result of the housing stress or the material hardship sort of remains to be seen. So those are some of the things that we're going to talk about as we invite you to think about some of the implications as Carolyn started to tee up for us. So next slide, please. I think if we dive into the stress model, one of the things I want to invite you to think about, before I came to Futures, I served for about 5 years at the Center on the Developing Child at Harvard University, where we spent a lot of time, you know, looking at sort of an integrated body of science, epigenetic, neuroscience, social sciences, as well as molecular biology, to try to really get at those mechanisms of how does the outside, as Carolyn says, something like material hardship, get in and under your skin and influence your health, your learning, and your behaviors. In this case, whether or not there's family violence in the home, the behaviors of abusive parenting. And some of what we learned in doing that work and that research is that context matters, and that our brains actually are not reactive ever. So I'm going to do a quick little exercise here and ask folks to just think of the first word that comes to mind if I were to say Jack and Jill, and then twinkle, twinkle. Just by show of hands, I'm going to ask you to help me, Susan. How many people sort of thought Jack and Jill went up a hill and twinkle, twinkle, little star? Just get by show of hands, how many people? Are those the first thoughts that kind of came to your head when I said those words?
All right, it looks like about a quarter of the audience.
Yeah. So would it be a surprise to anybody if you thought, if I were to tell you that what I was thinking when I said those words was Jack and Jill Association of America and Twinkle Twinkle Little Shoes, those Skechers shoes that kind of light up and are called Twinkle Twinkle. Just a brief little example about, you know, how our brains are constantly engaging, right, in the environment around us to try to sort of predict what's going to happen in an effort to keep us alive, to help us thrive, and to help us survive. And it does that, next slide please, because it's sort of bathed, our brain is bathed in sensory hormones as well as neurochemicals. There was a time where we believed that how we think, act, and feel were sort of separate components of phenomenon that were specific to specific parts of the brain. And what we know now is that there aren't specific brain regions that really regulate how we think, how we feel, and how we act. And instead, our behaviors and our learning and our understanding and our perceptions and our feelings are an output of constant signaling between the brain and our body and the brain and sensory output that it's sort of taking in from the world around us. As a fun fact, I was sitting on one of these science councils one time, and one of the neuroanatomists was explaining to me that I was astounded when I found this out, that when you're looking at the brain and trying to understand, right, how the brain communicates with the rest of our body to sort of inform our perceptions, our learning, our behaviors. It's the only organ in our body that when you take a slice of this, for all of you who are queasy about bench science, you know, take your Dramamine. But when you take a slice of a brain and then you slice right beside it and compare those two slices, you know, underneath a microscope, it's the only organ in our body where when you look at that, they're going to look completely different. So in every other organ, if we were to look at the molecular makeup or the anatomy of like adjacent slices of our liver or our kidney or our intestines, you're going to see symmetry, in other words. But when we do that and are looking at our brains, we can slice right beside and look underneath a microscope and see completely different molecular makeups and structure, which is a testament to how complex our brains are and the architecture our brains are, and it sort of provides some molecular evidence about how sophisticated our communication systems are between our brains, our internal sort of body signals, like from our heart, from our diet, from our sugar and glucose and salt, our body temperature, as well as the sensory input that we get from the world around us every day. And some of that sensory input, next slide, right, comes and gets processed in what we know from the science of resilience in a really sort of methodical way, right? So light comes into our eyes, we kind of figure out what all the shapes are, that slowly, right, gels into something that looks like a face in the environment around us, and it sends all of these messages to our brain to sort of say, oh, this is Carolyn. I know who Carolyn is. We've been like coordinating together to do this talk. And through that, I get signals about how to engage with Caroline and what to say and how to respond, because I know Caroline. But sometimes we get these sensory inputs, and depending on our life experiences and our memory and the amount of stress and trauma that we've experienced, we have shortcuts that kind of bypass all of that, sort of slow or quick walk to meaning making, and it goes directly to tell us whether or not we are feeling threat response and are not safe, and should therefore mobilize accordingly. So all of these things are implicated in what Caroline was sharing with us, because they speak to some of the underlying mechanisms that could help us to make sense of the association between different sources of housing stress and compromised behaviors in the home between a caregiver and their children. But for me, if we go to the next slide, I think what a lot of this means is that there's actually good news, because that some of the indicators that Caroline was talking about, to me as a former program developer, is that there are points of design and targets of design that we can think about. Caroline talked about some of them in terms of policy, but in some of the work that I do at Futures, we think about sort of therapeutic and supportive design touch points that can complement policies, in this case relative to preventing foreclosure filing, for example. I'm thinking of some of the things that Caroline was pointing out: homelessness or eviction, housing instability, housing inadequacy, all of the things that the research that she and her colleagues did, which helps us, those of us who are on the call who are doing prevention and intervention work, really zero in on what are the types of supports and experiences and conditions that we can actually create and put in place by design that would reduce those stressors, because it's not this one big global construct of housing stress that we don't know what to do about. Carolyn gave a really nice, clear list of the actual dimensions of housing stress: housing inadequacy, affordability, homelessness, eviction. These are solvable problems, and they can be solved through policy, but the experience them can also be solved through social intervention. And some of what I'm sharing here are protective factors that we've looked into at Futures in the context of touch points and experiences that we can create in therapeutic programming that would help reduce the experience of negative stress that impedes both violent relationship behaviors as well as buffer the negative impacts of experiencing violence in your relationships. And so just real quickly to go through them. And I share them here because domestic violence is one of the most common reasons that women give for experiencing homelessness. There have been studies that have been done, one in Minnesota, that found that domestic violence, that 1 in 4 women in homeless shelters in Minnesota were displaced because of domestic violence. Another study done in 2012, a national study, identified that 28% of cities in the several states that they looked at in that study identified domestic violence as the leading cause of homelessness among families with children. And so I offer these protective factors for those who are on the call, who are working at the social service level, to kind of think about as part of your programming to maybe mitigate the negative stress that's associated with homelessness that could come from family violence or the experience of domestic violence. So things like ensuring social, cultural, and spiritual connections, making sure that that children and families can experience safer, more stable conditions, experience kind of less bounce in and out of shelters, have more connections to their communities, to relatives and kin in the area, really creating space in programs, especially programs that are serving families who are housing insecure, for parents and children to have close, responsive, positive interactions and giving them the supports to do so. Thinking, for example, about what your housing practices and policies are at the shelter. Can you be more flexible in terms of meal times and bedtimes? Are there practices and supports in place, to help parents and children kind of navigate the stress of trying to get out of housing, find work, maintain sort of relationships with school and medical appointments? What types of supports can you offer in those programs to sort of help parents and children focus on their relationships during these moments of crisis and stress? And certainly really thinking about how you might promote programming and design that builds and strengthens parent and children's social and emotional abilities, helping them to sort of name and understand the feelings and the stressors that they're going through, and find positive ways to express and engage them, as well as considering, what are the strategies that they already bring to the table that have helped them survive before. Housing instability is not something that happens overnight. It's a slow creep. And so families have been dealing with those types of material hardships over time. And they've also found, positive and thoughtful and resilient strategies that you might be able to leverage if you create that space to design to some of that in your own programming. Next slide, please. I think these are resilience boosters. I'm not going to go over them because we're really pushed for time here, but I'll just let you know that they'll be in the slides that we share for you, and you can definitely look to them. They're sort of 6 kind of strategies, individual strategies that we know from the science of resilience are conditions or states of minds or practices and skills that can help people build and strengthen their resilience when they're experiencing severe and extreme stress, and happy to send other resources around them as well. And with that, Caroline, I'm going to hand it back to you to wrap us up.
Thank you, Tian. Yeah, and so just echoing everything that Tian said, just really want to emphasize this opportunity for multi-system partnerships, to think about how, when you're working in, whether it's housing, whether it's child welfare, whether it's other social services, how can these multi-system partnerships really identify these points of intervention to meet families' needs more comprehensively, and really improve outcomes for families, whether they're already involved with the CPS, whether they're at risk of being involved with CPS, but how can we work together to meet those needs? And again, just some key takeaways from this review and the science of what we know about the association between housing stress and child maltreatment is that evidence suggests that housing stress is associated with an increased risk of maltreatment, and that addressing families' housing needs may be an opportunity for forms of primary prevention, and that we do need continued evaluation of really innovative approaches to addressing families' housing needs, in addition to other social supports, as we help families through difficult times. And as Tian said, this isn't a phenomenon that happens overnight. This is a phenomenon that happens over time. And so how can we really work together over time to change these family situations? I want to thank my collaborators, Dr. Anna Austin and Dr. Megan Shanahan at UNC. And I have linked here the full article that we reviewed. Feel free to check that out or send me an email if you have any questions. So thank you all for joining us today.
Great, thanks. So we will take a little time for questions if you all have questions that you'd like to ask the presenters. We did have one question come in earlier regarding adult retrospective self-reports of child maltreatment, particularly sexual abuse, associated with housing and affordability. Are you aware of any studies which examine this link in terms of potential familial sex trafficking?
I'm not aware off the top of my head, and the study that we looked at did not look at sexual abuse in particular. We did not delve deeper into the sex trafficking or trafficking literature in general, but we did do a pretty comprehensive search of housing stress and various forms of abuse, including sexual abuse, and did not come across any studies there.
All right, I know that I have seen in the literature that there are certainly cases of that, and I'm not aware of any studies. But folks, you might reach out to the CVR's research librarian, through the Center for Victim Research website, which is victimresearch.org, and I'm sure she can take a look. We still have time for some additional questions if you want to enter them in the box. We did get one question about receiving the slides, so I do want to remind you all that if you take the feedback survey that will be sent to you, you will have the opportunity there to request a copy of the slides and to request a certificate of participation. Sorry to kind of hold that back, but we have found that it's hard to get feedback, but it's so important to us. So we're going to try that this time. All right, any additional questions out there? All right, I'm not seeing any come in, so I want to convey our gratitude to both of today's speakers. It really was informative to see where we are in this area of research, and then to see how we can take that research and apply it to our work with families and survivors to prevent and reduce ongoing child maltreatment and other forms of family violence. So thanks to both of you, Caroline and Tien. Is there anything that either of you would like to close with?
Just want to say thank you again for joining us today. It was wonderful to get to share this work.
Yeah, and I just want to thank you, Susan, and all of your colleagues. I really appreciate the resources that you have for practitioners and for survivors in terms of accessing a librarian to make sure that we can be up to speed on all the best knowledge about how to inform our work and our experiences. So thank you for that. And thank you, Caroline, and your colleagues for all your good research.
Thank you, Tien, for really pulling together the practice components and really bringing this down to the practice level, providing some really concrete opportunities for intervention.
And thanks to everyone who was able to join us today. Really, it would have been fun with just the three of us talking to each other, but it was great to have you all here as well. All right, thanks so much, and be on the lookout for the next episode of Evidence Hour. Goodbye, everyone.